Hello everyone, I'm Dr. Rachna Shanbag Moite, a pediatric immunologist and rheumatologist, and in today's video, let us discuss about ANA test. Beginning with a case discussion, this is a 14-year-old girl who presented with history of fever for 3 months, rashes over the face, alopecia, and oral ulcers. Her CBC showed anemia, lymphopenia, thrombocytopenia, CRP was normal, and ESR was elevated. Serum complement levels were found to be low. Therefore, suspecting an autoimmune disease, a ANA by immunofluorescence was performed, which showed presence of 3 plus positive and homogeneous pattern. A ANA profile performed subsequently showed presence of nucleosomes, anti-dsDNA, and anti-Smith antibodies, therefore confirming the diagnosis of systemic lupus erythematosus. So, what is a ANA test? ANA, as we know, stands for anti-nuclear antibody, which means these are antibodies produced against self-antigens present in the nucleus as well as the cytoplasm of the cell. It is a screening test used for screening various autoimmune diseases and can be found to be positive in SLE, juvenile dermatomyositis, scleroderma, and even mixed connective tissue disorder. So, what are the various methods by which a ANA test can be performed? There are 3 methods used for ANA testing, and this includes ELISA, indirect immunofluorescence, and line immunoassay. However, ANA by immunofluorescence is the gold standard method, and a usual report of ANA by immunofluorescence tells us whether the ANA is positive or negative, the pattern by which the positivity is seen, such as homogeneous, speckled, centromere, nucleolar, etc., the intensity of the positivity 1 plus to 3 plus, and the titer at which the positivity is found. In this case, 1 is to 640. Subsequently, the type of pattern of positivity also tells us the type of antibodies involved, such as a homogeneous pattern indicates presence of anti-dsDNA, antihistones, and anti-DNP or nucleosome antibodies. Now, why is this important? When we perform a ANA profile, we get the type of autoantibodies present, and that helps us to classify the autoimmune disease further. And this also has other significance, such as presence of anti-dsDNA antibodies in SLE patients also has a correlation with the disease activity and also with correlation of developing nephritis. Similarly, anti-ROLA antibodies, as we know, is associated with neonatal lupus, and antihistone antibodies are associated with drug-induced lupus. Let us look at another case. This is a 10-year-old girl who has presented with body ache for past 15 days. She complains of vague aches and pains all over her body. However, in this case, there is no history of alopecia, no history of characteristic butterfly rash, or even oral ulcers. CBC when performed is normal, CRP and ESR are within normal limits, and even the serum complements are normal. However, ordered a ANA test, and as you can see, it is also positive in this case. However, this child was not diagnosed to have SLE, and this report was disregarded. Now, why is that? That is because, as we know, that ANA can be positive even in 5 to 10% of healthy individuals. Therefore, one must have a high pre-test probability. That is, ANA test must only be ordered when there are symptoms specific for autoimmune diseases. So, coming to the next question, can ANA test be negative in SLE? Let us find out. This is the characteristic precipitation curve. This we know that whenever antigen and antibodies are present, they come together, bind to each other, and form precipitate, which indicates a positive test. However, in some condition, when the antibodies are present in excess, they may not bind to enough antigens and may create a negative test. This is known as a pro-zone phenomenon, and in these conditions or individuals with high antibody titers, the ANA test may be negative, and in such cases, we must request the lab to repeat the test at higher dilutions. What are the other causes of negative ANA test? It may be a false negative test, or in individuals with antibody deficiency, despite of having symptoms suggestive of SLE, the ANA test might be negative. So summarizing, ANA, as we know, is a screening test for autoimmune diseases. 5 to 10% of healthy individuals can have a positive ANA test. Therefore, one must have a high pre-test probability before ordering a ANA test. ANA by immunofluorescence is the gold standard, and ANA profile gives us clue to the underlying autoimmune disease. Thank you.